as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Momo. Join me and my colleague, Dr. Keith, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and good afternoon or hello everybody. I am Dr. Amy Momo and welcome to Health Talks. I am your host today and here with us is our co-host Dr. Keith Primer.
Hello, Dr.
Good Friday.
It's a pleasure being on the show with you. Hello, Celebration TV viewers. Welcome to Health Talk today.
Today we are going to talk about hypertension, a common but real life-threatening disease. And it's so common that most people have it. About 1.28 billion persons worldwide have hypertension. And the age range of such persons are within 30 to 75 years. Two-thirds of such persons are seen in low-income or middle-income countries. And so you can see that hypertension is really common and it has so much complications, so many complications. So we cannot just like look over it. We really have to tell you more about hypertension. I guess you agree with me, Dr. Kate.
Yeah, sure. Of those, that figure that are hypertensive worldwide, more than a half of them do not even know that they have hypertension.
Sure.
Yeah, that's because, like we say, it is a silent killer.
It is.
Yeah, many people go on with elevated blood pressure without even knowing. Yeah. And it is very important because hypertension is one of the commonest causes of sudden death worldwide. Yeah. And it is it's one of the highest risk factors for both brain, kidney, and heart diseases worldwide. And for people who even know that they are hypertensive, only 1 in 5 persons will be able to attain adequate blood pressure control. That is because they have not adapted to adequate lifestyle and probably medications if need be.
You know, some of our viewers will be wondering what we're talking about: hypertension, high blood pressure. You know, hypertension is also called high blood pressure. Yeah. And they'll be like, what's the reading? Well, as in the systolic, diastolic, most people hear about that. What is hypertension? How are we going to know about it and all? So I think the definition and more information on this is very important.
Okay, yeah.
Let's tell our viewers about
pressure,
this. Yeah.
Or hypertension is when we say the force with which the heart is pumping blood through the blood vessels is now at an increased range beyond the normal. Yeah. Normally, you know, the heart and the blood vessels, they work like a pump and a pipe. Yeah. The heart pumps the blood and it goes through the vessels to supply other tissues. And the force with which it pumps, they should be within a specific range. Once it goes beyond the normal, the heart will now be working against a resistance in the vessels to pump blood. And this happens commonly when the arteries, which are ordinarily supposed to be very malleable, they lose their elasticity. And then the heart is now pumping with a higher force. So that's why when we check blood pressure, we say there's what we call the systolic and the diastolic. Yeah. The systolic blood pressure is the pressure in the vessels when the heart is contracting and pushing blood out. While the diastolic is the pressure when the heart is relaxing and taking in blood before it will now pump again to organs. So once the force with which is now doing this increases, then there is a problem.
Yeah. Usually, you know, those days the 130/90, 130 systolic, 90 diastolic. millimeter mercury when checking, it was usually the
was said to be normal.
Yeah, exactly, it was said to be normal. But now it's not so. In fact, if one has 130/90 reading, then that person is said to be hypertensive.
Yes, that's because over the years, research has shown that people who were carrying an elevated blood pressure reading that were not termed hypertensive, they came down with same long-term complications that people who had hypertension also came down with. Yes. So the values were reviewed.
Exactly.
Before we used to talk about 140/90
yes,
as high blood
but
pressure.
not anymore.
Yeah, not anymore. Now we take values. Once your systolic blood pressure is above 130, it is hypertension. Now normal figures now for normal blood pressure is any systolic blood pressure less than 120 and any diastolic less than 80. Yes. Once it starts climbing up, we now talk about elevated blood pressure and hypertension in itself. Yeah.
So you can see the issues, and it's kind of surprising when you see one who have 130/90 reading coming up with a renal problem or hypertensive complication. I guess it was really shocking, but now thank God that we had to reduce, or medical practitioners at WHO.
Yes, that's because with you know, before you can say an individual has high blood pressure, we must have checked the blood pressure more than once.
Exactly.
Yeah, it's not. We use the word sustained elevated blood pressure. So some people may have a spike in their blood pressure due to events.
Exactly. You know the common one now, white coat hypertension. Just imagine going to the hospital and seeing everybody on white and they're like, oh my goodness, how am I safe? No, I'm behold, the pressure shoots up. Exactly, just shoots up. So we don't call that hypertension because that person actually is apparently normal, but because of the situation, the blood pressure kind of increased. So what we do is to tell the patient to be calm, sit, be calm, and thereafter recheck again.
So once you check and it is sustained, it is elevated over a period of time, at least 2 to 3 readings on different occasions, then that individual has high blood pressure.
Yeah, it has. Another scenario is when one gets frightened, maybe there's a snake or there's an information like, oh my goodness, oh, this is a snake, run, something happens, I'm over, whatever, and the pressure just shoots up like that. So the BP goes high. But in that situation, just imagine, the BP should go high, 130/90 and all. Just imagine such person, because of the fright, we check the BP and realize that the BP is like, blood pressure is like 180/110. Oh boy, that one is
when you start having pressures like 180 above 110, it may just be that the individual has had hypertension and did not know and is probably having a hypertensive emergency.
So a spot diagnosis on hypertension
can happen.
Yes, when the BP is above 1, or let's say 180/110, no matter the situation, whether it comes to the hospital and sees all white, or people or workers on white, or here it has a scare, as far as that BP is 180/110 above, that's hypertensive
emergencies generally, and people like that will also come with symptoms. You know, basically, like why we call it the silent killer. Hypertension will gradually creep in on people, and they do not know that they have it. Sure. And it does not come with any symptoms, unlike other illnesses where you start having pain and all that. Now, people are hypertensive and they do not even know. But once they come with pressures as elevated as that, 180, 110, and they start coming with headache, dizziness,
that's an emergency.
Blurring of vision, you know that they have already started to have complications. And it is something that you deal with. You won't wait to recheck the blood pressure again before making a diagnosis of hypertension.
So we have hypertension is actually divided into 2 types: the essential hypertension and the secondary hypertension. The essential hypertension do not have a cure. Yes.
Unfortunately.
Unfortunately, yeah. And the cause is unknown, unfortunately again. But the risk factors, we have so many risk factors, or we will tell you so many risk factors that's issues or things, situations that can lead to this essential hypertension. While the secondary hypertension, because it's actually known, might be due to various diseases like
kidney disease,
hormonal disease like hyperthyroidism.
Yeah, and then people who have maybe drug use can tilt people towards having hypertension. However, the incidence of secondary hypertension is low. Between only 5 to 10% of all the people who have hypertension will have the secondary hypertension.
Yeah,
so the commonest one is the type 1 hypertension or the essential hypertension. For that one, yes, like you said, there's no known cause and there's no known cure. However, risk factors are well known and it can be managed. Hypertension on its own would not kill an individual.
No, but
it is the complications of uncontrolled hypertension that will kill.
Sorry to chip this in. For the secondary hypertension, the cure, actually, when you treat the disease, then
once you take away what's causing the secondary hypertension, the person would have achieved a cure. Yes. For the type 1 hypertension, the risk factors that are associated with them, we usually group them into ones that you can modify and the ones that you cannot modify. When we say modifiable risk factors, those are risk factors present in an individual that you can do something about.
Exactly.
You can change.
Yeah.
Once you are able to take away that risk factor, your chances of having hypertension will reduce. Yeah. Sure. Yeah. Some of those modifiable risk factors is diet.
Yes.
Yeah. Now like, we know that for diet, salt intake in food, is very much implicated in essential hypertension.
You know why?
Yeah.
Because usually wherever salt goes, sodium goes, water follows. Yeah. And you know salt is made up of what?
Sodium, mainly sodium. So
to increase the pressure in the vessels.
Yeah. Whether salt coming in as food or salt in seasonings that they use in food, or salt used as preservatives in canned and processed foods. All those ones, once you have a high intake of salt in your diet, it will increase your chances of having type 1 hypertension.
Also, also
another modifiable risk factor.
Obesity.
Yeah.
Then
sedentary
lifestyle. Once
you know this era of people working from home. People sit at home and work. So there's reduced. You can get almost everything you want now on your phone.
Literally, I'm telling you, you can just sit and say, "Oh, I want to get this." You don't need to go to the market these days. Just call and the food comes. Everything comes in there.
So because people are laid back and they do not engage in physical activities, so it increases their chances of having type 1 hypertension.
So
smoking,
alcohol,
smoking, alcohol intake. All those ones are factors that people can actually modify that are implicated in type 1 hypertension. Then there are other factors.
Eating of red meat,
Yeah, that's diet.
Eating of red meat also.
Diet. So and consumption of high fatty food in diet. Yeah. Then the factors that you may not be able to change, like you said, hypertension is commoner between the ages of 30 to 75. Yeah, 75, 79. Yes. So once you start aging, your chances of becoming hypertensive increases.
You don't have anything, as in you cannot do anything about that. Yeah. Like we all will age someday.
People will always age. So as you age, your chances increases. Sure. Your gender too, as a male, your chances of becoming hypertensive is higher than a female. However, when a female reaches menopause, our chances of becoming hypertensive too increases and catches up with that of the male.
Yeah, I guess some of our viewers would have been happy that, thank God I'm a female.
I'm a female and I won't have hypertension.
But because I was smiling just now.
No, you can still have it even at a young age. Even if you escape it, once you attain menopause, your chances will increase. So you are also at risk of becoming hypertensive. You were happy you were going to escape that one.
Yes, at least now.
Okay. Then your your family history is also an important factor in hypertension.
Sometimes people, it could be hereditary, like once mother, father has it.
Yeah, once you have one parent who is hypertensive, your chances of coming down with high blood pressure is like 17%. Okay. If you have both of them, it's like 45%. So it is a risk factor too that you obviously cannot do anything about. You have been born into such family. But these things are actually things that we can work on and prevent you from becoming hypertensive. Even if you now are hypertensive, you can have controlled blood pressure that will not give you issues. Yeah.
So we have the number on the screen. Feel free to communicate with us, call us, and send your questions, send your contributions. We are here to answer you. Feel free, and we await your call.
Yeah. So like we said, those people who have this type 1 hypertension is just to follow doctor's prescription, follow a doctor's counsel. Sure. Many people who have hypertension may not even require medication. No,
just
lifestyle
modification.
Yeah. You know, the health-seeking behavior of an individual. You know, the concept of hypertension is quite unique in itself. That it is one disease that is one condition that the patient does more than the doctor. Yeah, because you already know that your lifestyle, your diet, and your personality type are the 3 major factors implicated in this. So if you are able to watch your lifestyle and you watch your diet and your person type too, it's also an implicated one. Like for stress now, for example, you know, people have, there's what the executive stress, where people who work overtime, they work a lot, and then they don't find time to rest and relax.
Sleep well,
because once you don't sleep well, your chances of hypertension will increase, because normal blood pressure is like a circadian rhythm. Blood pressure is lowest at night. Yeah, it starts to rise when you wake up in the morning, and it is highest during the day. Now, if people do not sleep at all, that period that the blood pressure should have come down, it will keep rising. So people who go through undue stress from issues of life and all that would have issues with their blood pressure control too.
So you can see that, man, it's really a wide topic, as yes.
So, but it is something that can be managed when people are deliberate in controlling the factors that are responsible for hypertension.
So when we talk about the hypertension, because we said hypertension itself do not kill the person, but actually the complications of hypertension is involved.
I think we have a call.
Okay, this is Peace from Kogi State. Hello, Peace. Welcome to Health Talks. Feel free to ask questions or give some contribution.
Yes, please. I want to know how high blood pressure is managed in pregnancy.
Okay, thank you.
Yeah.
Thank you. Yes, she said she wants to know how high blood pressure is managed in pregnancy.
In pregnancy?
Yes, this is another...
Okay, that's quite an interesting one. Sure. Thank you, Peace, for calling
in pregnancy.
Yes. Hypertension can also occur in pregnancies.
Yes.
It may be that the person already had hypertension before they got pregnant.
Or it's pregnancy induced.
It was the pregnancy that induced the hypertension. So before you say it was pregnancy that induced the hypertension of an individual, the BP would start climbing up from 20 weeks of pregnancy. True. Yeah, and it is commoner in first time mothers. It can happen in anybody.
That's private.
Yes. So if one is hypertensive in pregnancy and the doctor finds out that it is the pregnancy that is causing it, the cure for that hypertension is delivery of the baby.
Yes. Yeah, true. But however,
so the blood pressure can be controlled.
We control
it will be controlled until you deliver. Once you are delivered and the placenta comes out, the chances that the blood pressure will come down is very high.
Yes. Except the person actually has hypertension prior to that time and might not have checked.
Yeah.
You know, some people, they don't really check their BP. Yeah. But if that person or that person comes to the hospital maybe 4 weeks of pregnancy, if that person comes, what happens? Now, the person will now know. The doctor will now ascertain if it's pregnancy-induced or normal hypertension.
Or chronic hypertension.
Yeah. Imagine somebody comes to the hospital and is 4 weeks pregnant and you realize that the BP is very high. Oh, but the person already had hypertension before.
So hypertension in pregnancy, it can be managed. You have to be on medications. Yeah. And the beautiful thing is that in most cases, once you deliver, the blood pressure will come down. But if it doesn't come down, then your health practitioner will do something about it for you.
Yeah. Okay, so one more thing concerning Peace's question, because she was asking how it's going to be managed.
Okay.
So explain to her that
she'll be on medication most likely, depending on how high the blood pressure is.
But talking about this pregnancy-induced hypertension, you know, it's closely related to, you know, preeclampsia and all. Because there are some people, when the blood pressure increases, then we don't stop there. We go check their urine and check for what? Protein in urine, yes. And other liver enzyme assay and all. So to know if that person just have hypertension alone or actually has preeclampsia. Yeah. And preeclampsia is kind of a grievous or kind of a complication that we doctors will not play with at all, because it can cause, it can go to or develop to eclampsia, seizure, and can affect the baby and all. Yeah. So what we do usually is to put the patient in medication, monitor their blood pressure, monitor their urine and all, essentially.
Exactly. So, and we are able to pick when any complication is going to arise in it, because the baby is at risk when you have preeclampsia or eclampsia.
So it's how to handle hypertension
in pregnancy. No, that's what we have. That's the same question that Peace asked, that we just dealt with. Yeah, it is a multidisciplinary care. So you have to see your obstetrician, and then they will decide what is best for you. Exactly. So follow your doctor's counsel and prescription, if any.
Yes, and also I have to chip this in as much as this is pregnancy induced, you still have to watch your diet and you still have to stay active.
Yeah.
Exercises, eating the right thing, and all, even in pregnancy.
Exactly.
Yes.
That's all right.
Okay. All right. Right now, we're going to go for a little break. And when we come back, we're going to give you so much more information on hypertension. Stay tuned and don't go far from your devices. Thank you. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague, Dr. Keats, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Mom. Join me and my colleague, Dr. Keats, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV. Live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. Welcome back to Health Talks, and we're talking about hypertension, also known as high blood pressure. I remain Dr. Amy Momo, and this is our co-host, Dr. Kate.
Thank you. Glad to know that you're still there.
Yes.
Yeah.
So, we're talking about hypertension and its issues. Now, we have to talk about complications because, as we said, hypertension itself do not cause death or so much so grievous like death and other things, but and do not really show the signs. No. But the complication of hypertension actually leads to death and leads to so much signs that the patient might elicit. And
if you are known to be hypertensive, or you don't even know, and you're not doing what you're told to do, it will become complicated.
Exactly.
And like I said, hypertension can affect almost every organ in the body.
True.
Yeah, from the brain itself. You see somebody just has a stroke, for example. Yeah, it could be due to severely elevated blood pressure.
True.
And the stroke could be any of them. It may be that with the force of pumping the blood through the vessels, the vessel may just burst.
Exactly.
And the person bleeds into the brain.
Exactly.
Yeah. It could be that it was a plaque, maybe a fatty tissue in the blood vessel that dislodges and go and block a part of the brain and prevent blood and oxygen from reaching that brain, and the brain dies and the person suffers a stroke.
As ischemic stroke.
Hypertension can lead to blindness, to go and destroy the arteries to the eyes. Some people who are blind actually is because of hypertension.
Yeah.
It can. It can destroy the heart in itself.
Yes,
you know, God has done it in such a way that once you use something for too long, it starts to increase in size. You see wrestlers and boxers, because they gym, they become bigger. In hypertension, once the heart is now doing too much job, it's now pushing blood at a higher force, the heart will start to enlarge. And once it gets bigger like that, the heart itself is supplied by blood vessels that keeps it alive. So because it becomes big, the blood supply to the heart will also reduce. And that's when you see people now come down with myocardial ischemia, what we call heart attack in itself, because a part of the heart itself is now too big and is not getting enough blood supply.
Yeah, and also, you know, when there's this fatty plaque, you understand? Because you know that fatty plaques and all, they can make the vessel very narrow and all.
Can block the blood vessel.
If that plaque is dislodged, and that thrombi goes, or emboli goes all towards the heart vessels, like the vessels that supply the heart tissue.
It will block it.
Yes, that's the coronary arteries and all.
And the person will have a myocardial infarction.
Exactly.
When you say somebody has a cardiac arrest due to uncontrolled hypertension. Yeah. Also, and when the heart is getting big in itself, because it's working too much, it will lose the force with which it can pump blood.
And it now looks like this balloon. They call it balloon of the heart. Imagine how a balloon is very soft and big. That's how the heart is.
And then the heart
pulling blood. Yes, and it cannot pump. Blood will come in, it cannot pump out. Blood. That is what we call heart failure.
Yeah. And because the valves in themselves will now stretch and they collapse too. So the person, you see people who come with difficulty in breathing because there's so much fluid pulling in their lungs and in their heart. Because their legs are swelling. All those ones are because the heart is failing because of uncontrolled blood pressure.
Exactly. And this blood goes to the lung.
Yeah. The fluid will start pulling in the heart. Okay, we have a call from Mr. David.
Hey, Mr. David. Welcome to Health Talks.
Good afternoon.
Okay, feel free to talk to us.
Program this afternoon.
Oh, that's awesome.
I heard all the conversations you had on television.
Wow.
So, my question is, sleep-inducing drugs, does it also contribute to high blood pressure?
Sorry, come again. Sleep what?
Sleep-inducing drugs.
Okay.
Sleep-inducing medicine.
Okay.
Yeah. Does it also contribute to high blood pressure?
Increment in the blood pressure.
Okay. Thank you for your
I want to
answer. Oh, thank you for your question.
It's not advisable to take inducing medicine.
Okay. Thank you very much, Mr. David. Thanks for your call. basically, when they are managing you for hypertension, some doctors may give you sleep-inducing drugs. You know, like we said, if you don't sleep well, your blood pressure may go up. So for some time, they may give you drugs to make you sleep. Well, then it will not worsen your blood pressure. It doesn't worsen blood pressure. However, when you are now dependent on drugs to sleep, then there is a problem. If you're having issues with sleep, you should consult your doctor, and then they will work out a good sleep hygiene for you. It may allow you sleep even without using drugs, but ordinarily the drugs will not increase your blood pressure. But it's not good to be dependent on drugs to sleep.
And we do not encourage going to get over-the-counter drugs. No. So please, as my colleague has said, as Dr. Kita said, you have to go to consult the doctor. And do not get used to this sleep-inducing drugs. However, it's not like a cure. As we say, essential hypertension do not have cure.
But can help you manage.
Most times, we doctors, we give you some sleep-inducing drug. However, we still give antihypertensive and all. Yes. All right.
So then another organ too that hypertension will destroy is the kidney. Oh, yeah. Hypertension. Well, the kidney and hypertension, it's like a vicious circle. Yeah. Hypertension can destroy the kidneys. And the kidney problem can destroy, can cause hypertension in itself. So, and we've seen the incidence of many kidney failures worldwide, and some of them are due to hypertensive nephropathy. Once you have poor control, the kidneys may be affected. Okay, we have Barrister Israel calling in from Abuja. Good afternoon, Barrister Israel. Welcome to Celebration TV Health Talk. Hello, good afternoon, sir. Welcome. Sir.
Good afternoon. God bless you.
Thank you.
Thank you, sir.
My name is INT'L. I'm thinking about it.
Okay.
All right, we can hear you.
Please, I want to know low blood pressure, low sugar level.
Okay.
Low blood pressure, low sugar level. I keep high blood pressure, what's the low blood pressure?
Okay, sir.
Okay.
All right, sir.
All right, sir. Thank you, sir.
Well, he says he wants to know what is low blood pressure
and low sugar level.
No,
he keeps hearing.
Yes, there are conditions where your blood pressure will be lower than normal. Yes. But basically, you will not have low blood pressure as a chronic medical condition, just like high blood pressure, like a long-term thing. There are issues that can cause low blood pressure per time.
Exactly.
It could be excessive bleeding. Somebody is involved in an accident and is bleeding, blood pressure will come down. It could be sepsis. Yes. It could be infections. Sepsis will cause a hypovolemic a hypovolemic shock in itself from blood loss, and sepsis itself can cause low blood pressure. Some people they just have a low blood pressure naturally. Some people will go with pressures as low as 100/60. Yeah, it doesn't mean that they have low blood pressure. That is the blood pressure that they have, and it is compatible with life.
Yes. However, when one takes drugs, medication, like the person is hypertensive and take so much of that medication, like
it can crash their blood pressure temporarily.
Yes.
Yeah, when they use drugs that are supposed to be used for hypertension.
Yes, maybe they take 2 tablets instead of 1 tablet, and it can reduce the blood pressure.
And then same thing with low sugar level. It is caused, once an individual has low sugar level, it is caused by something. Is there an ongoing illness?
Yes.
Is the person using drug overdose? Yeah,
and
so people will generally not have a low blood sugar level as a chronic long-term medical condition.
And also, if such person maybe did not skip meal, when you skip meal and you do not take food, you don't eat, you skip your meals and all this, it can actually cause hypoglycemia. That is
there are some common myths too that people associate with hypertension. Some people will tell you that because they have hypertension, they were giving medications. Okay, when my BP is normal after ingestion, then I am totally cured. Unfortunately, like we say in type 1 hypertension, we do not have a cure. But the drugs and your lifestyle changes will control your blood pressure and you do well. So there's no need stopping the drugs for a long period because you have attained a cure. It is not possible with type 1, except it is the type 2 hypertension that the person has. But you can attain stable blood pressure that won't give you problems. Since my parents are not hypertensive, I can never be hypertensive. That's not correct.
Although there's a link of hereditary and all.
Yes.
But however, one's parents might not be hypertensive.
And yet they become hypertensive.
Yes. Based on the lifestyle, it can just happen spontaneously.
Yeah.
So no, it's a myth.
It's not. Because your parents do not have does not mean that you cannot have. Thinking can cause hypertension. Well, it depends on what the person calls thinking. We know that stress, daily stress would make hormones to be produced by the body.
But if I may chip this in, do you know that in our local environment, people actually think that, oh, because of thinking, because of so much worry.
We have diagnosed people with hypertension, and they tell you that I'm not thinking anything. How come I have hypertension?
In fact, there was a scenario when somebody was like, oh, that I would hear that the siblings also had hypertension. You're like, oh, she too they think. Good. So in quotes, so much thinkingness. Oh, too they think. Oh, no, this and all. They have this notion that
it's not correct. The person already has probably one of these risk factors attached, and then they may have their own problems, stress problems, and all that. But thinking basically will not give people hypertension. Yeah.
However, you know what? You know, irrational. People that are always angered. Angry persons.
Yes, we talk about personality type.
Personality can actually...
Yes, deep-seated anger,
such can cause hypertension.
That's because with that, your personality state, your body produces chemicals that will make your heart to work more than normal. Yeah, and it can tilt people towards coming down with long-term
so you can
hypertension.
imagine one keeping malice, being angry, and everything. Of course, you see why the Bible is important.
Yeah.
It's good to be
Christian.
Christians.
You see how important it is.
So you have to become unforgiveness,
yes. Because it will make you start producing steroid hormones that keeps you unfortunately agitated for too long, which is not good. Hypertension is only a disease of old people. That's not true. We are seeing even children as low as 3, 4, 5 years can have hypertension. But for those ones, we know that there's something that is probably, they may have a tumor in the kidneys that's causing that. Once you go and remove that tumor, the hypertension will come down.
However, remember what I just said concerning 1.28 billion persons have hypertension. Yeah. At the age 30 to what? About 70.
Yeah, that's a common age.
So 30 years is a young person now. So you can imagine 30s, people being in 30s having hypertension. Yeah. So hypertension is not a disease of the old.
Now, we have, in managing hypertension, the common things that you do is your diet, like we said, the lifestyle. There's what we call the DASH diet. Yes. Not everybody who has hypertension will even use medicine. No. By adhering to a diet alone would help. We encourage them to take a lot of fruits, a lot of legumes, a lot of nuts, cutting down on red meat, more of poultry, fish, nuts. All those ones would help to control hypertension.
To add also, in the management, medication in management is also very important. Always adhering to the doctor's prescription. Go meet the doctor. Take your drugs regularly.
You should have one doctor, usually better, rather than doctor shopping from one doctor to the other that does not know your history. So adhering to diets alone and doing an adequate lifestyle, exercises, weight loss. It's so that once you lose weight by 10 kg, your blood pressure will reduce between 2 to 20 millimeters of mercury. So, and exercises too would also help to reduce blood pressure. Avoid smoking, quit alcohol intake, then have a good blood pressure follow up.
Yes, then do not skip your
medications.
Do not skip your medication.
If you are hypertensive.
Always check, even though you have drugs, always check your blood pressure. So thank you very much. This this is the end of today's talk with the doctor. Today's health talk. This is the end of today's health talk. Thank you for staying with us. Thank you for hanging on. And I guess you must have enjoyed so much on this topic. Hope to see you soon. I remain Dr. Amy Momo, the host, and this is our co-host.
Yeah, thank you. Thank you for staying with us all through. God bless you. Thank you, Dr. Amy.
Thank you very much, and have a nice day. as kids, as teens, as youths, and as the elderly. Countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Momo. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority.